In this image, you can see both the artery and the vein. The artery is thicker walled due to more muscle and is resistant to collapse from the ultrasound probe's pressure on the skin. The vein is thinner walled, collapsible, and has lower pressure. In this image, the vein is a little bit anterior and a little bit lateral. Here, we are standing at the patient's head with the right side of the neck prepped and covered with a fenestrated drape. To start, it is advised to move the ultrasound probe up and down the artery and vein to find where the vein is the largest and where you have the most decent separation between the artery and the vein. This would be described as the short axis view. In this view, you want to have the patient in the head down position because the vein is a little bit bigger than it would be if the patient were lying flat. You also have protected the patient from either pulling air in or making it easy to collapse the vein. In this short axis view, be aware that it is easy to tell the difference between the artery and the vein, but it is harder to see the needle tip. If you rotate the probe to the side, you appear to bring the vein on top of the artery. And so to guard against this, always try to point the ultrasound probe at the floor. If you continue to rotate the probe 90 degrees from the previous short axis view, you will now be looking in the long axis view. Directing the probe a little more medially, you will be able to see the artery. If you were to move the probe laterally, you would be able to see the vein more clearly. If you were to stick the vein with the transducer oriented in this long axis view, you will be able to see the needle tip coming in. This is because you are looking at both the needle and the vein in the long axis view. However, there is not much room in the neck to do this, so the majority of people stick the vein in the short axis view. If you push the transducer on the vein, it will collapse it, which will make the caliber of the vein much smaller. The concern with the long axis view is that it is easy to misinterpret the artery as the vein because the difference between the two is less obvious in the long axis view and only one vessel is visible. Starting with the probe in a 90-degree sagittal view, you will begin by rotating the probe 45 degrees clockwise. In doing so, this will begin to elongate both the vein and the artery, so you are now in the oblique view. This view allows for you to bring the needle into the long axis in plane. Starting from the traditional view, if you rotate the probe laterally, you will see the vessel is changing and will end up in the oblique view. If you continue to rotate further, you will approach the long axis view. When you tilt the probe medially and a little posterior, you will bring the pulsating artery into view.